Hello, I'm Glenn W. Hunter, Hunter and Beyond LLC, and this to my side is Dr. James George of Excel Physical Therapy and Wellness. Dr. George, how are you today?
Doing great. Thank you. How are you, Glenn?
Doing fantastic. Hey, we're excited to talk to you today about something that's important from a healthcare perspective to lots of people. And I think Dr. George is going to be able to bring a very interesting spin as he ties homeopathy into high blood pressure and how to reverse it. So, as we begin our conversation on hypertension, we're going to look at it from a lot of different angles, and we're going to just start right from the very beginning of how it could have started, is in our past. So, Dr. George, as we get rolling, how much of hypertension is hereditary?
Well, we know that a lot of certain group of people from certain ethnic background, they have high blood pressure as a something which runs in their family. It's been transferred right from their ancestors, and we know that there is research being done about it. And so there is some genetic predisposition causing people to have high blood pressure.
So when you're looking at it, you can't so much, move back away from your heredity. I mean, you cannot change your genetic makeup, at least not with outside of the science fiction movies. But when you start thinking about how that those hereditary traits play in, there's also the opportunity for behavioral traits to play in. And so again, when we start looking at high blood pressure, how much of it is behavioral?
Yes, for example, it is known that there is research background that type A personalities, people who are always on the run,
Mm-hmm.
the go-getters, the big achievers, it is known that they tend to have high blood pressure. So these people are always stressed. A little bit of a stress is okay, but too much of stress, can cause high blood pressure. And also behavior-wise, people who are not eating enough fruits and vegetables and more of other stuff. I don't want to name them. You know that. We all know that.
Mm-hmm.
The good stuff are the fruits and vegetables, and all other stuff. When you eat those ones too much, and that also. So that's a behavior. People tend to eat that, and that causes those processed foods. A lot of processed foods, and with a lot of salt in it. That sodium chloride
Mm.
causes increase in blood pressure, and that's why they say to control the salt intake. But there is research which says that about 30% of the people who have high blood pressure would benefit from controlling their salt intake. But uh, telling everybody to control salt intake, but some people may need that salt. So it is very important that find out whether you want to try and avoid salt in your diet and see whether that makes a change in your blood pressure. If it doesn't, your body, just like any other mineral, you do need salt as well. So, with respect to behavior, if somebody doesn't sleep well enough, right,
Mm-hmm.
7 hours of sleep, that is known to, there is research that is known to cause people ending up in having high blood pressure. So, having enough rest is important. And not exercising enough, again, that is behavior. Not exercising enough 5 days a week, at least 30 minutes of exercise would also help with that. That is again a behavior. So there's a lot to it. It's not only hereditary, genetic predisposition, people uh, not having proper behavioral pattern, all right, the right behavior of the way they do their day-to-day life could also cause them to have high blood.
Hmm. So as you're talking about some of the behaviors, you talk about rest, exercise, how that plays in. Those things are very much within the control of the individual. But then culturally, you end up with, I guess, different pressures, especially when you start thinking about food. Is that consistent with your perspective that culture, food kind of coincide to create a different kind of pressure than can be handled just through a behavioral change?
Yes, culture, certain cultures, they the typical pattern is to eat a lot of processed food,
Mm-hmm.
and then the culture of getting the fast food, all the time.
Mm.
I'm not against eating once in a while for fast food, but that being, having 2 or 3 meals a day fast foods, which is loaded with salt and whatnot. We don't know what the things are in there, but so the culture of not having enough fruits and vegetables in the diet is a problem. Yes.
I see. So we've talked about some of the pressures that are on the individual as they're making choices that could lead to hypertension. But what techniques have been successful for you in terms of stopping or reversing high blood pressure?
Well, as I said, there are people who would benefit from decreasing the salt intake, but you do need 1200 mg to 2000 mg of salt per day for your proper bodily function. All right. So that is important. Less salt intake can cause cramps and cause your brain not to function, cause dehydration, so a lot of other stuff. Uh, so it's important. It's like a balance, right? And as I mentioned, increasing fruits and vegetables is important. It's known that consuming too much of coffee, which is a cultural thing, as we discussed, coffee is known to cause high blood pressure. And coffee is it works on your nerves, your brain. So and too much coffee intake also causes you not to have enough sleep. It's all interrelated.
Hmm.
And having too much sugar, or foods made with sugar, also is known to cause high blood pressure. And people with chronic pain are also known to have a high blood pressure because the pain sensation which is felt in the brain actually in turn uh, causes high blood pressure. Sends signal to have high blood pressure. You have sensors in your neck, or which controls your blood pressure. All right. Uh, they are called the carotids. They have sensors in there, and they send signal to the brain to control your blood pressure. And there are centers in your brainstem, which also have a control on how much your blood pressure as well. So many times, blood pressure is not only you have the genetic predisposition, your brain has also an effect on your blood pressure control. And people who have been exposed to heavy metals are also prone for high blood pressure. And people who have mental disorders like anxiety, depression, bitterness, anger, these people are also prone for high blood pressure because it makes a change in your brain, causes causes those people to end up in having high blood pressure. So there are a lot of reasons for somebody to end up in having high blood pressure.
Wow. I mean, you just gave us a breadth of categories, whether it's life choices, the hereditary component, the dietary component. All of these things can contribute, which I guess makes things very interesting for you as you're working with somebody who's trying to ease their blood pressure. But my question to follow up on that is, what behaviors have the potential to reverse hypertension?
Yes, so I said the causes for high blood pressure. So basically, you go back to them and address them. When we address people to have, they need to have at least 7 servings of fruits and vegetables minimum in a day.
Hmm. Okay.
7 servings of it. Now, fruits and vegetables naturally have potassium. Potassium, especially root vegetables. You know,
Hmm.
these sweet potatoes, carrots, and almost all fruits have potassium. Potassium is known to help with decreasing your blood pressure. But better than supplementing with potassium, which is a kind of a balancing act, having adequate intake of fruits and vegetables, which is like along with the other minerals, you have a better you can control your blood pressure better by having more at least 7 servings. Now again, decreasing sugar intake, right?
Hmm.
That could help decrease your blood pressure. And then coffee intake. I'm not saying not to take coffee, but taking too many cups of coffee in a day can cause you not to have enough sleep. That in turn can cause you to have not having enough sleep. There is research background which says that people who are not sleeping well enough uh, are ending up in high blood pressure. Then we talked about salt intake again. So decreasing salt intake for certain people that would help reverse your high blood pressure. Now, above all, we talked about your mental health disorders. So consulting with a psychologist would help. The counseling would help. Now, homeopathy can also help naturally help heal anxiety, depression, anger issues, and depression, bitterness. It's known those mental health issues can be helped and healed using homeopathy, and along with psychological counseling help as
Hmm. As you mentioned, all these things that a lot of them are quite common, and I have to confess, I'm slightly guilty of maybe overindulging in coffee. But you talk about the ability of homeopathy to reverse that. Can you provide a little bit more insight how that ties directly into some of the successes you've seen with your patients?
yeah. Remember we talked about in the past. Homeopathy is we use most of the time it's mineral based or plant based and a diluted form of minerals and plants. And we all know that minerals and plants are helpful to control blood pressure. I told earlier, fruits and vegetables. But the diluted form is similar to nanomedicine. It goes directly into your cells and activates your cells. And also, it activates your immune system to calm down. Especially people with stress. We discuss about type A personalities. People who have a lot of stress. Homeopathy can help them calm down. So there are a lot of remedies in homeopathy which helps heal anxiety, depression, and bitterness, anger issues. Yes, that's why when we provide a consultation for homeopathy, we ask questions related to your mental health issues as well as your emotional problems, along with the physical issues where we ask about high blood pressure and everything. So there are more than 2,500 remedies in homeopathy. Once we once we collect your symptoms and we match the symptoms to the correct remedy and the correct remedy is taken, it helps heal high blood pressure. And also, we talked about genetic predisposition for high blood pressure. We cannot we cannot change our genes, but we can switch off the bad genes and keep the good genes switched on. And there are a lot of research background for that as well. And homeopathy helps in that. Nutrition helps in that. You know, yes, yeah, we have the tools to help people reverse high blood pressure.
So, as you talk about the tools, which are very tangible ways to minimize high blood pressure, um, I'd like to see you maybe dig a little deeper with how can you help someone? How can you help a patient battle through hypertension? hypertension by using telehealth.
Yes. So telehealth nowadays, you can give me a call over the phone, or call our office at 909-792-5050, and we can set up an appointment. We use Zoom meeting, we use iPhone FaceTime, to talk and get the symptoms. It's important to find out all the symptoms. Homeopathy is a whole person care. So we look into all the symptoms you produce or you have currently, from your mind and emotions. So we need to talk. We need to find those symptoms. Usually, this consultation is about minimum an hour to 2 hours, and then we find the correct remedy. Once the correct remedy is taken, it helps reset your organism, reset your body to start healing, and helps keep your bad genes switched off. And of course, I have also studied functional medicine. I give nutritional advice on along with homeopathy, what could be taken to help heal your high blood pressure naturally. We don't prescribe any prescription medicines here. There is a place for prescription medicine, but if you're looking for something natural, that is what we do here.
In today's environment, homeopathy and telehealth actually can converge toward helping your patients win the battle against hypertension.
Yes, yes, of course, because now with the current pandemic and people are hunkered down, many people don't want to come outside the house because of the pandemic. Especially, the elderly. We know high blood pressure is prevalent in, the middle age and high plus. So homeopathy and telehealth and nutrition advice can be very helpful. You don't have to come to my clinic. We can do it through telehealth and help you with that. And also, what information I want to say is there is recent research that says people with 65 plus, you don't want your blood pressure to be too low, because they have found that lowering the blood pressure too low also can cause mental problems, especially memory issues, and leading to dementia. So you want to have, there's a term called essential hypertension, and maintaining at 140/90 is a good, is ideal blood pressure for especially the elderly. And so we do not. That's where natural products and homeopathy can help maintain your essential hypertension rather than lowering it too low down using telehealth.
Okay, outstanding. So we have options, we have tools. They're at the disposal of Dr. George to help patients with hypertension. And in conclusion, Dr. George, can you give your number one more time so that patients can find you and basically get healthier when they're struggling with high blood pressure?
Yeah, our office number is 909-792-5050. And we give us a call and we'll set up the telehealth appointment for you. And we'll go from there.
Again, Dr. James George of Excel Physical Therapy and Wellness, providing wisdom, providing knowledge, and his expertise to help us be more healthy, more functional, more productive, and to come out of this season of pandemic a lot better equipped to live longer. Dr. George, thank you again for your wisdom and your ability to just share these ideas to help people live more fulfilling life.
Thank you.
Again, Glenn W. Hunter, we look forward to talking to you soon. Tell a friend about what we're doing. Please pass it on. Thank you.